Are you a senior living on a fixed budget? It's not easy, is it? But stay tuned because we're kicking off Boost Your Budget Week and we're going to give you some ways to save. Stay tuned. Hey, good morning, everyone, and welcome to a very special edition of Scan FYI. Did you know that April is National Financial Literacy Month? Ooh, that's a mouthful. Well, it is. And because of that, we are kicking off Boost Your Budget Week. What's Boost Your Budget Week, you ask? Very good question. Our two guests today are exactly the people to answer that. First, we have with us Brandy Bauer from NCOA. There's Brandy. Say hi.
Hi, everybody.
And we have Helen from SCAN, and Helen is our BEC coordinator, Benefits Enrollment Coordinator. So between the three of us, we're going to give you a lot of good info. And by the way, our BEC hotline number is right on the screen to make it easy. So Brandy, let's start with you. First of all, what's Boost Your Budget Week?
I'm so glad that you asked. So, one of the things we know at the National Council on Aging is that many older adults are struggling. They're on a fixed income. And we also know that the pandemic has really exacerbated that for a lot of people.
Yes.
It's hard to pay for your medications, your food, your transportation. We also know that there's a lot of community-based organizations like SCAN out there who are working as benefits enrollment centers, who are helping older adults connect to a wide range of programs that can help them to afford the basics of living. What we know also is a lot of seniors don't know about these programs. They don't realize that they may be eligible for them. They don't know how to get assistance. And so we created Boost Your Budget Week as a way to unify information about these programs and all of the great variety of agencies out there helping people to really focus on the fact that these are available to you. You can apply at any time. You can get help from your community agency, and you can, in fact, boost your budget. These benefits will help put money back in your wallet.
And it's always better in your wallet, right? Always
Correct.
Better in your wallet. One thing we say frequently on Scan FYI is that what good is a resource or a benefit if you don't know it exists? Mm-hmm. And so this is really meant to shine a light on a whole host of benefits that unfortunately not enough people are taking advantage of and are likely eligible to receive money in your pocket.
That's right.
So maybe Helen, maybe you can tell us about what kind of benefits are we talking about here? And first, tell us a little bit about the BEC and your role.
Okay, the BEC is a division of SCAN, and we're about 2.5 years in now. And we screen seniors, low-income seniors, and disabled adults, and we make sure that they are getting all of the benefits that they could be entitled to. We happen to use a screening tool that comes from NCOA, the Benefit Checkup, and it gives us a report and will let us know just with some basic questions if anyone would be qualified for a myriad of benefits. And I'm the coordinator of SCAN's Benefit Enrollment Center. And besides myself, we have two other counselors that do the same thing. We have Dory in Monmouth County, and we have Laura in Ocean County. So we have coverage in both counties. And what we're looking for are mainly, there's 5 core benefits. The main ones that we check to see that the seniors are getting, like if they're eligible for their Medicare Part B premium being paid, or help with prescriptions to see if they're Medicaid eligible, help with their energy, electric, gas, and to also see if they qualify for food stamps. Besides that, we've got a lot of other programs that could be more local. We have transportation. We have, even for people who are not strictly low income, there are a lot of other benefits out there.
Right.
Some people know about them, like you said earlier, some don't know. But even things like getting discounts on Easy Pass, there's a senior discount on that. And, little things like that, this report will tell you all of the benefits that are available. And let's see, and we do this by, again, the screening. And then if you're eligible, we help you with the application or refer you to the proper agency. So there are a myriad of benefits out there, and the savings are very significant. The Medicare Part B premium alone, if somebody's been paying it all along and they shouldn't have, they can save, I think it's over $1,700 over the year.
Well, that's a lot of money.
Mm-hmm.
That is a big chunk of money. You know, Brandy, what do you say to folks who are watching these ads on TV about Medicare savings and all, you know, all these celebrities doing these, what I imagine are great paying gigs? Should we be listening to them?
Yeah, I see this all the time, and it's like buyer beware. I want to say, you know, they're not scams per se. What we do know is, you know, there are, you'll often see these ads and it'll be like, call us and find out all of these Medicare benefits that'll pay for transportation and meals and, you know, all these things that sound great. It's free to sign up. You should just be aware that those are usually from an insurance broker, an insurance company, and they're for a very specific private Medicare Advantage plan. Those plans do sometimes have some of those benefits, but there's a lot of fine print. It's usually often only available to people who have specific health conditions. You know, you're not going to necessarily get free transportation unless you're going to dialysis 3 times a week. Or, you know, there are other co-payments that they don't tell you about, but that's in the fine print on the ad. That's why we really tell people, you know, don't trust an ad on TV. Go to an organization like SCAN, or go to, in every state, there's a SHIP, which is State Health Insurance Assistance Program, which is free, unbiased assistance. They will help you search for, you know, Medicare that covers what you need and other benefits. But yeah, don't be calling up, you know, some of these celebrities on TV just because it sounds too good to be true.
Well, you know, when it's too good to be true, when it sounds too good to be true, it usually is too good to be true. And I do want to emphasize too that any screening that you get from SCAN, it is always free.
Great.
And we'll do this by phone or by video call, right, Helen?
Yes.
Whatever's best for you.
Mm-hmm.
That's important to remember. We're all about what's best for you.
Right. We work with everyone individually because seniors, we know it's a problem with technology. Some of them don't have it in order to do things virtually, but we work individually with each person, whatever works for them. And there's so many different possibilities, but, you know, we just take each one separately and, you know, can help them some way get their copies, get their applications, whether it's hard copy or, you know, holding something up to your screen if they can do that, but we find a way.
You know, I think it's important also as you're listening to this, SCAN's BEC folks, we will not only tell you what you are eligible for, but we will help you with the application, because as Helen mentioned earlier, not everyone is tech savvy. Some people may be struggling with literacy issues, but we will take care of it. We will guide you through the entire process. The BEC hotline number is on the screen. We'll have it in the Facebook comments as well. And this entire week, which is, again, Boost Your Budget Week, shining a light on this whole situation of making people aware. But Helen, please remind people that it's not just this week.
We're here all the time. We are here every single day. Again, the office has technically been closed for a while. We do have somebody manning it. But we have our phone numbers where you can reach the benefit enrollment consultants directly. So you'll get the number that will be on the screen, and you can call us anytime and someone will get back to you. And it's not just for this week, it's for every day.
Right. This week, we're just shining a light on the issue that so many people are really entitled to many benefits and they're not taking advantage of it. And Brandy, what are some of the barriers that stop people from getting their benefits?
Yeah, we see that a lot. You know, people, number one is they don't think it's for them. They think that like food stamps, oh, that's for, people with children, not realizing that, there's about 5 million people, older adults in this country who qualify for SNAP or food stamps who aren't getting it because they don't realize that they're eligible for it. Another thing is sort of, to Helen's point, it's the application process. And for a lot of people, even, educated, literate people, those forms can be confusing. You don't know, what are they talking about when they're asking me about assets, which is why the service of a benefits enrollment center like SCAN is just invaluable. They will walk you through every step of that process and help troubleshoot. If the agency comes back and says, we don't understand this, or, you have an issue, SCAN will help with that and help to ensure that if you are eligible, you'll get into that program.
All right, well, this is a really important week, Boost Your Budget Week, because always the money is better in your pocket. And don't rule yourself out and think it's not for you. It's a free screening and you're not going to know unless you call that number and speak to a benefit enrollment specialist, right? Okay, Helen, any final thoughts you want to share with everyone?
No, I always just say, call us. It doesn't hurt. It's just a phone call.
Just a phone call.
Be worth something in your pocket, and we want you to age well, and it's worth a try. It's always worth a try. And I want to thank Brandy also for being our special guest.
Yes,
Pleasure.
thank you, Brandy. Thank you.
You're welcome. We love partnering with organizations like SCAN. You guys are doing such great work to help older adults age in place and get money back in their wallets.
Two of the best things ever, age in place and get money back in your wallet. What's better than that? Again, it starts with a phone call, so please take the time, make the call. If you can save money, that would be a great thing. It's time to boost your budget so you can age well. Okay, well, Brandy, thanks for being our special guest today.
Thank you. My pleasure.
And Helen, thank you. Helen is SCAN's Benefit Enrollment Coordinator. And I'm reminding everyone, call that number, boost your budget. You've been watching a special edition of SCAN FYI. I'm Andrea Tarr, and we will see you back here very soon. Boost your budget. Bye, everyone.